This is Dr. Benson Kelly from the St. Regis Mohawk Health Services, and we are going to be doing a weekly question and answer session for ATV, and we would like you to call in or write in with questions, mostly about COVID, because that's the hot topic right now. So I have 4 questions today that I'm going to try and answer. And as we all know, things change quickly with the COVID, and everything that I say is could be changed a month down the road or whatever. The first question says, should I get tested for COVID-19 before I get the vaccine? And the answer is no, you should not. The vaccine is cleared for everybody over the age of 16, and there are levels of who's getting the vaccine and who isn't. If you have had a positive COVID test within the last 30 days, we ask you to wait to get it until 30 days from when your symptoms ended. We also ask you not to get the COVID vaccine if you are not feeling well. We really want your symptoms to be gone before you get the vaccine. The only way you should get a COVID test before the vaccine is if you do not feel well. And we all know the symptoms of COVID, which are fever, cough, shortness of breath, difficulty breathing, congestion, loss of smell, loss of taste, things like that. Question number 2, I tested positive for the COVID-19. Can I get the vaccine now? If you have tested positive in the past, you still should get the vaccine. Our policy is it really should be about 30 days from the time of the last test, positive test, I'm sorry. So again, you can get the vaccine if you have had COVID-19, but we ask you to wait approximately 30 days. Before you get the vaccine, people will be asking you this question anyway. Question number 3. I was in quarantine. Do I now need to carry my release from quarantine with me? Interestingly enough, we just recently had a patient who went to the eye doctor, and as part of the routine questioning, they said, have you ever tested positive for COVID? The person had a couple of months previously, but had totally recovered. The office wanted them to have their note from public health that they were released from quarantine, and the person did not have these papers. So for those of you who have had a positive test and been under quarantine or isolation, when you get your papers from Franklin County or St. Lawrence County, it's a very good idea to have them with you, or else if you could make a copy just to put in your wallet or your purse, because there may be doctor's offices who ask for that period. In the long run, people are saying you may need to present this to get on an airplane or get a hotel room, things like that, but it's a good idea to hold on to these papers. And the 4th question is, should I go to the IGA weekly to be tested? The answer is a strong no, you should not. What we are noticing lately when we are putting all the results of the COVID tests into charts, there are many people who have had 7 or 8 tests since November of 2020. And I think a lot of it is just because there is testing available at the IGA or at Mountain Medical, period. It's not a good idea to get these tests done just because it's there. You should have symptoms or a known exposure to another person with COVID or have been sent by your provider. I have actually had patients say they were driving by the IGA, saw the line, and just got in line to be tested. The testing is not meant for asymptomatic people. And those of you who have been there in the past probably also realize that there are times when they run out of the tests before everybody is tested. And I think many people who get the test do not really need it. So please keep that in mind. If you do not have symptoms or have not been contacted or in contact with anyone who has COVID or have not been sent by a physician, please do not get tested. This is just a general suggestion. And I know that a lot of people feel more comfortable and more safe because they had a negative test. But believe me, that is a false sense of security. So please do not get tested unless you have a definite reason. Thank you very much. Have a good day.